Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to our podcast. Today we're exploring an important topic that touches many lives: addiction and the complexities surrounding it. Before we dive in, it's essential to note that the information shared in this segment is for educational and reference purposes only. It is not intended as medical, psychological, or professional advice. Addiction is often thought of in terms of visible symptoms, particularly physical withdrawal. Many people have experienced moments when they realize that stopping a behavior or substance can lead to uncomfortable feelings. But what about those instances when someone can stop without obvious physical symptoms? This leads us to an important understanding. Addiction does not always involve physical withdrawal symptoms. Withdrawal refers to a specific set of physical or psychological responses that occur when the use of a substance or engagement in a behavior is reduced or stopped. While physical withdrawal is common with many substances, its absence does not automatically mean addiction is not present. Some substances or behaviors can be addictive, yet may not produce significant physical withdrawal symptoms. A common misunderstanding is the belief that without physical withdrawal symptoms, an addiction cannot exist. In reality, psychological dependence and compulsive behavior are critical components of addiction. For instance, when someone feels a strong urge or craving to engage in a behavior despite negative consequences, that can indicate a significant level of addiction, even if there are no physical symptoms. Addiction is characterized by compulsive engagement with a substance or behavior. This engagement persists, often against one's better judgment, despite experiencing adverse outcomes. It's not uncommon for individuals to struggle with controlling the frequency or duration of their engagement. Physical dependence is different from addiction. Withdrawal is a feature of physical dependence, which can occur without addiction. For example, certain prescribed medications may cause withdrawal symptoms when stopped, but the individual may not be addicted to them. Thus, the absence of physical withdrawal does not mean that someone isn't grappling with addiction. It could simply mean that their body is not physically dependent in a way that produces overt symptoms. Consider behaviors like gambling or excessive internet use. These can exhibit addictive patterns without involving any physical withdrawal symptoms. The core elements here are the compulsive nature of the behavior and the continued engagement in it despite facing negative consequences. Now, it's important to clarify what this does not mean. The absence of withdrawal symptoms does not render withdrawal irrelevant to addiction. When present, withdrawal symptoms serve as crucial indicators of physical dependence. Additionally, the presence or absence of physical withdrawal does not determine the severity of an addiction or how challenging it may be to cease a behavior or substance use. It's also worth noting that addictive behaviors can involve activities that do not directly impact physical physiology in the same way that substances do. Understanding these nuances matters, especially for recovery communities and public health discussions. Awareness of the psychological aspects of addiction can facilitate more compassionate support for individuals in recovery and their loved ones. For those interested in careers in substance use disorder counseling or behavioral health, grasping these concepts can be enlightening. It can help prepare you to assist those navigating the complexities of addiction. Topics like this are often explored in addiction counseling education. Programs such as those offered at InterCoast colleges include discussions about behavioral health and recovery support. If you'd like to learn more about education pathways in this field, you can visit intercoast.edu.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.